Good afternoon, and thanks for joining us here today. Before I begin, I'd just like to apologize in advance. We don't have our ASL interpreters here today on short notice, unfortunately. They're a very in-demand group, and we weren't able to get them. But, there will be closed captioning on our Facebook feed later. So I'd also like to begin by thanking Dr. Sevier for graciously stepping in while I was on vacation and leading us through the fourth wave of our COVID-19 pandemic in our province. And Dr. Sevier has been an integral part of our COVID response throughout the pandemic, and it certainly was reassuring to be able to go on vacation knowing that the province was in such capable hands. So thank you, Dr. Sevier. Since the last media advisory, we have 30 new confirmed cases of COVID-19 in our province. 27 are in Eastern Health. 21 of these are under the age of 20 and are all contacts of a case. 1 is under the age of 20 and is under investigation. 4 are between 20 and 39. 1 of those is a contact of a case. 1 is related to travel, and 2 are under investigation. There is also 1 individual between 40 and 49 years of age that is a contact of a case. 3 people are in Central Health and are all contacts of a case. 1 under the age of 20, 1 between 60 and 69, and 1 over the age of 70. There have been 14 new recoveries, leaving 62 active cases in the province, and the total number of COVID-19 cases for our province is now at 1,928. 4 people are hospitalized as a result of COVID-19, and 855 tests were completed since yesterday for a total of 327,666 to date. So I wish I was here with better news on this beautiful Friday afternoon. We called this briefing today to report a new cluster in the Marystown area. We now have 25 cases in the area, with 22 of these under the age of 12 and mostly school-aged. There is an outbreak at Sacred Heart Academy in Marystown with 21 students testing positive, and Public Health has recommended that that school move to online learning. We do not know the source of the outbreak. However, as with all outbreaks, public health officials are working diligently on the investigation and contact tracing. As a result, we are moving several communities on the Burin Peninsula into Alert Level 3 effective midnight tonight. This will encompass areas from Red Harbour south to Epworth Grand Salmonier, including John de Bay, Spanish Room, Rock Harbour, Marystown, Beaubois, Fox Cove, Mortier, Burin, and Lewins Cove, as well as Frenchman's Cove and Garnish. Please refer to our website for the map that outlines these areas. As a reminder, under Alert Level 3, your household can interact with up to 10 close, consistent contacts. Gatherings at funerals, burials, weddings, and religious and cultural ceremonies are limited to no more than 20 people. Public visitations are permitted with 1 household at a time. Fitness facilities, swimming pools, arenas, and dance studios have a maximum capacity of 20 people per room or ice surface, provided that physical distancing can be maintained between household bubbles. Group and team sports, arts, and recreation activities, including group lessons, are suspended. Retail stores, including those in shopping malls, have reduced capacity with physical distancing. Restaurants can open for in-person dining at 50% capacity, as long as physical distancing can be maintained between patrons seated at adjacent tables. Performance spaces, bars, lounges, cinemas, and bingo halls are closed. Public Health is recommending against non-essential travel from the Burin Peninsula to other areas of the province at this time, until the full extent of this outbreak is determined. If you may have been exposed to COVID-19 and have questions about testing and self-isolation, please use our new guidance tool. This is now available on our COVID-19 website under the heading Public Health Guidance. You can input your exact circumstances and it will provide guidance specific to your situation. Regardless of your community's alert level or your vaccination status, if you have even 1 symptom of COVID-19, please book a test. You can do so using the self-assessment and testing referral tool on our website. And even if your test is negative, you should stay home until 24 hours after your symptoms resolve. As a reminder, symptoms include fever, cough, shortness of breath or difficulty breathing, runny, stuffy, or congested nose, sore throat or difficulty swallowing, headache, acute loss of sense of smell or taste, unusual fatigue or lack of energy, new onset of muscle aches, loss of appetite, vomiting or diarrhea of more than 24 hours, and small red or purple spots on hands and or feet. Not everyone experiences COVID-19 the same, even with the more severe Delta variant. Your symptoms may even be mild or similar to the common cold, so the only way to be certain, one way or the other, is to be tested. We encourage anyone who is not isolating and not yet been vaccinated to have their COVID-19 vaccine. The rates for those fully vaccinated on the Burin Peninsula is quite good for those over the age of 50, but they are progressively lower with each age category down to the 20 to 29 year age category with the lowest rate of 67% fully vaccinated. We need all eligible young adults across the province to get the COVID vaccine to protect yourself, your family, and those who cannot be vaccinated, such as the children under age 12. Clinics are available across the province, so please make the time to get the shot. Starting next week, you can also get the flu shot from your pharmacist, physician, or regional health authority vaccination clinic. If you have not received the COVID-19 first or second dose, you can receive it at the same time as your flu shot. It is important to get the flu shot every year to prevent severe illness, but even more so now that we have the added risk of COVID-19. For anyone just joining us, there are 30 new cases of COVID-19 in our province with a total active case count of 62. Thank you to everyone that has made the time and the choice to get the vaccine, and for everyone that has been abiding by public health guidance. For everyone in the Marystown and surrounding regions, we are thinking of you and working hard to keep you safe. We will get through this, just as we always do, with patience and perseverance. So hold fast, Newfoundland and Labrador. Thank you. And I'll turn it back to Leslie for questions.
Thank you, Dr. Fitzgerald. We have 1 media in person and 3 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Dr. Fitzgerald, I'm wondering if you can explain for me, why have we seen the spread so quickly in that area? Just 2 days ago, we didn't have any cases in the area. Now we're dealing with 30. And so many of them spread within that school.
Yeah, so certainly it appears that at this point in time, anyway, it's very early in the investigation, but it looks like the onset of symptoms was over this, first onset of symptoms was over this past weekend. And so, you know, none of these children are vaccinated, unfortunately, so it is, and there's quite a lot of interaction in the school, but there's also interaction outside of school. So I think the investigation, and I'm not on the ground at the moment, so it's evolving by the minute, it seems, but certainly there are a lot of contacts as well outside of the school situation, so through social groups and sporting teams and other things like that. So, you know, just lots of opportunity for that, for the virus to spread.
And I want to ask about sports teams, because I understand there was a tournament in the area last week. There was another one that was supposed to be happening this week, but I think has now been canceled. Has that played a role, and is there any concern that when you've got teams from different areas of the province getting together that they could take the virus back with them?
Yeah, so that's always a concern, obviously, yeah. And we don't know at this point if the tournament that happened last weekend has played a significant role in the transmission. We're certainly, you know, that's something that public health will be looking at in the coming days, I'm sure. But any time that you have an outbreak in one area and we have people visiting that area, then obviously there is that risk. And that's why we've asked people, even though this alert level is more defined right around Marystown and Burin, we're asking people on the Burin Peninsula in general, just because there is a lot of connection between the schools and children and, you know, other groups and teams and that sort of thing, to really not travel off the Burin Peninsula at this time until we really know what the full extent of this is. You know, we're just, there are so many cases in the school with a fair number of contacts. We need to make sure that, you know, we get that testing done, so that general testing in the community hasn't happened yet, because we are still busy doing testing with those contacts. So,
we will now go to the phone. Our next questions are from Beth Penny with NTV. Please go ahead.
Thank you. I know on the Newfoundland and Labrador English School District's website, they said that there will be enhanced public health measures in effect for other schools on the Burin Peninsula. Could you outline what some of those enhanced measures might be?
Yeah, so we are certainly, or public health has recommended that, there would be cohorting where that's able to be done effectively, that enhanced cleaning measures more so than what is normally done, similar to what we had during the height of the pandemic last year. Also looking at, mask wearing for all students in all schools, and other, no extracurriculars, the suspension of extracurricular activities, and the use of the schools by communities.
Thank you. And I know at-home learning will be available for students at Sacred Heart Academy. Will it be available for any of those other schools on the Burin Peninsula where the enhanced protocols are taking place?
So at this time, the only school that's been recommended to go to online learning is Sacred Heart Academy. The reason for that is just simply because there are children in, essentially all grade levels who have tested positive. So at this point, it's it seems reasonable. We have spread throughout that school that they will go to online learning, but we have not found anything like that in any other school. And so at this time, there's no recommendations for online learning being made by public health for any other schools.
Thank you.
Our next questions are from Noah Shepard with BOCM. Please go ahead.
Hi. Pierce Junior High in the area has students from a wide range of communities, the ones that are now under Alert Level 3. Many are siblings of Sacred Heart students that may have been close contacts. Is there any specific procedure for those students?
So public health will look at each person individually, each contact individually, and make recommendations. So, our new, with regard to vaccinations, if you have vaccinated contacts, then the isolation requirements or quarantine requirements are somewhat different than if they are not vaccinated. And so it will depend on the vaccination status of the person. And then for other close contacts, it'll depend on how close the contact was, how high risk the exposure was. And those decisions get made on a case-by-case basis. But for the most part, if people are vaccinated at this point, then they're not, isolation or quarantine is not required if they're fully vaccinated. So that's 2 weeks past their second dose of vaccine.
The area that's under Alert Level 3, including Marystown, which is kind of the hub of the Burin there, there's many people outside of that alert level range who work in Marystown. Is there any specific procedures that those people should follow if they work for one of the essential businesses in Marystown?
Yeah, so certainly travel for essential purposes like work or, medical reasons, things like that is still okay. And, anyone who's working in the area right now, you just need to follow those tried and true public health measures. So wear your mask, wash your hands well, keep your distance, and just make sure you have, for businesses to make sure they have those protections in place for their employees as well.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon and welcome back.
Thanks.
How many schools in the province now have cases? We heard of, I believe, 4 or 5 that Dr. Sevier mentioned. What do we know exactly how many have cases now?
So at the moment, this is the only other school besides those that were mentioned previously. And I'll be honest with you, I'm just back yesterday, so I don't have a breakdown of every school right now that has cases, as most of that was sort of handled prior to my coming back. But we can get that number for you, Peter.
Okay, thank you. And do you have an idea of the vaccination rate in the area?
Yeah, so in the vaccination rates in that area itself is fully vaccinated is about 82.7%, so between 82 and 83%, and that goes from a high of almost 97% in the 70 to 79-year-olds to a low of 67 or so percent in the 20 to 29-year-olds. The 12 to 19-year-olds are about 78% fully vaccinated in that area.
Thank you.
I will now go back to each reporter to see if you have one final question. Peter Cowan with CBC. Do you have a final question?
I want to ask about rapid testing for schools, because Nova Scotia, for example, has really embraced this. They've sent home lots of tests with the hopes of being able to maybe find some of these cases early on. Are we looking at doing any sort of rapid testing for schools, and do you think it might have made a difference in an outbreak like this, that we might have seen some of those cases a little bit earlier if we had been employing rapid testing?
So I think, it's certainly something that we're looking at, absolutely. We have to be careful, as we said many times before, about how you use rapid testing, and using it in people who are asymptomatic may not give you the best bang for your buck. But certainly looking at how we use it in symptomatic people. I don't know if it would have made a difference in this case. It's still very early on in the investigation, but I do know that the initial case, we did find out about it fairly quickly. It was, so I don't know that it would have made a big difference with regard to speed of response in this situation.
Beth Penny with NTV. Do you have a final question?
Yes, thank you. Today, the province's vaccine passport came into effect. 2 days ago, I believe the Premier tweeted that over 297,000 people downloaded their QR codes. Are those the numbers along the lines of what you were hoping for by launch day?
So I'm not, as you know, I've been away for about a month, and this outbreak has sort of taken up my time since I've gotten back. So I really have to defer any questions about the vaccine passport at this time. But, I think overall we're very happy with the response that we've gotten to date, and very pleased that people are embracing it.
Noah Shepherd with VOCM. Do you have a final question?
I do. The Prime Minister announced yesterday that Pfizer has submitted their pediatric COVID vaccine to Health Canada for review, and I believe Alberta has already indicated the number that they wish to secure. Has Newfoundland and Labrador joined the queue, so to speak?
So once, there's a process in place where we get a percentage of vaccine based on your per capita. So we have no concerns with the amount of vaccine that we're going to get. We certainly expect to be able to get enough to vaccinate who we need to.
Thank you.
Peter Jackson with The Telegram. Do you have a final question?
Yes, and it is a question about vaccine passports. Specifically, one of the rationales of the passports mentioned a month or two ago was the idea that businesses could stay open if there was an outbreak in the area. But it would seem that under alert level 3, we're closing non-essential businesses such as bars, etc. anyway. So in what circumstances would the passport be an advantage?
So I think, this is happening at a time when we're just bringing the passport in. And so as time goes on and as we see how the passport works, that may be something that we'll be able to delineate a little bit more clearly. But at this time, I think, we're reacting to what's in front of us right now. So I'm not sure it's really fair for us to try to apply it at this point in time. People have to get used to how to use it. They have to get used to what it means, and we have to make sure that we have widespread enough uptake that we can do that. So people need some time to get used to that vaccine passport at this point. So. But yeah, in the future, it's a good question. I think we need to look at that and consider how we use the vaccine passport to enable society to stay open.
Thank you.
Thank you, everyone. Dr. Fitzgerald, do you have any final comments for today?
Thanks, Leslie. Just hang tough, Marystown, Burin, and area. We're thinking about you. And get vaccinated if you haven't gotten your 2 doses. Make sure you get your second. If you haven't gotten your first, please go out and get vaccinated. Get tested if you have any symptoms, and hang in there. And I hope everybody has a good weekend. Thanks.
Thank you, Dr. Fitzgerald. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect A lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.